time for Q&A. I want to remind everyone that we are recording this event, so if you are uncomfortable being recorded, please be sure not to ask a question. We will be saving this webinar for posterity on the National Service Learning Clearinghouse website. So again, this is Liberty Smith from Learn and Serve America's National Service Learning Clearinghouse. I'm delighted to have you all here today for this webinar co-sponsored by the Clearinghouse and Community Campus Partnerships for Health. This topic is near and dear to our hearts, maximizing the long-term sustainability of service learning, lessons from a study of early adopters. We are delighted to be discussing this. We know this is an issue of great interest, both at our beloved funder, Learn and Serve America, and throughout the country as we all experience more investment from the federal government and more need from local communities to see that our community efforts are really paying off. So thank you for joining us. Because we are also eager to hear what our panelists have to say, I'm going to turn this over to our moderator, Kevin Days. He's the advisor for higher ed special initiatives at Learn and Serve America. So Kevin, if you'll unmute your phone and take us away, that will be fantastic. Thank you so much.
Kevin, if you would press *7.
Hi, can you hear me?
Yes.
Okay, great. I apologize. We're having a little bit of technical difficulty. I want to apologize for joining the call late, but again, I want to echo the words of my colleague, Liberty Smith, and say how excited we are that we are able to have this webinar to talk about maximizing your long-term sustainability of service learning. At the corporation, primarily what we're interested in doing is getting the seeds to service learning set. We see our funds as those funds that help get the effort off the ground, and then we try to move those funds to other places. So we are really interested in learning the lessons now that we've had about 15 to 16 years of experience of seeding and 15 or 16 years of seeing what works. We're just so happy to be able to host this, to co-host this webinar to talk about those lessons learned and to figure out what some of the earlier adopters were able to do to maximize their service learning sustainability. And we were very, very impressed earlier this spring when Amanda was able to come to the corporation and share the fruits of her research into that study, and that we thought that this is something that needs to be shared broadly, and we've done that and through this first attempt through the webinar. And so I don't want to take up too much of your time. I already wasted a bunch of your time by struggling to get online. So I want to turn this over to my colleagues, Amanda and Serena, to talk about this session. And then once they've completed their presentation, we'll have some time for question and answers. So Amanda, Serena, would you please take over?
This is Liberty stepping in one more time. For any of our speakers, and once we do open up the line for questions and answers, please try to do what you can to use a handset rather than a speakerphone when presenting or asking questions. We really want to be sure that this webinar serves both in this moment for all of us on the line and for future folks who weren't able to attend today. So sound quality is very important to us. So please do what you can around sound quality as you're speaking. Thank you very much.
Hi, Hi, everyone. This is Amanda Vogel. Just to reiterate what Kevin and Liberty have said, we're thrilled that so many people could join us today, and we're very much looking forward to sharing findings from this study. I wanted to just let you know a little bit about how we plan for the call to go. The presentations will run about 45 minutes to an hour, and then we'll have about 30 to 45 minutes for question and answer and discussion. And since we have such a big crowd, we're going to hold Q&A for the end, but feel free to use that Q&A box on the bottom right corner of your screen to type in any questions that occur to you. And then at the beginning of the discussion, which Kevin will moderate, we'll have the opportunity to go through those questions in addition to the verbal conversation that we're hoping to have. I'm going to start with some learning objectives and then turn it over to Serena, who's going to give some background about the cohort of schools that participated in this study. There are 3 learning objectives for this talk. The first is to learn about key facilitating factors, challenges, and strategies for success that influenced the long-term sustainability of service learning in one group of early adopters, the schools that participated in the HPSISN program, which Serena will tell you about. The second is to identify concrete strategies that both academic institutions and funding agencies can use to support the long-term sustainability of service learning. And the third is to be able to discuss these findings with your colleagues to enable you to learn from your own experiences as a group with sustaining service learning. Serena's now going to provide a little bit of background. And Serena, if you want me to move the slides for you, I'm happy to do that.
That would be great. Can everyone hear me okay?
Yes, we can hear you.
Okay, so wanted to make sure I wasn't on mute. Well, thank you so much to the Clearinghouse and the corporation for helping us put this webinar on today. And as Amanda said, I'm going to give a little bit of background about the program that is the basis of this study. It's a 10-year follow-up study that Amanda completed of this cohort of health professional schools that were funded to do service learning. And the program, we keep referring to the acronym HPSISN. It's the Health Profession Schools and Service to the Nation program. So it had a long name, and we call it HPSISN. And in the next slide, there are some bullet points that just give an overview of what this program was all about when it was initially funded, 1994 to 1998. We believe it's the first and only national demonstration program for service learning in health professions education. And there were some components to the program that all of the sites participated in. First of all, there was a sub-grant component. Each of these institutions received about $75,000 over a 3-year period, and it had to be matched 100% in cash or in kind by the institution. And they were funded to integrate service learning into their core curriculum. They could start out perhaps with an extracurricular or elective kind of experience, but the goal was over the 3-year period of funding to integrate service learning into core courses in the curriculum and to develop community academic partnerships for service learning. All of the sites also participated in training and technical assistance. During every year of this program, we brought the grantees together for conferences, workshops, that sort of thing, professional development. We also had webinars like we're having today. So there was a program that these institutions participated in over that 3-year period. And the funding was from the corporation for, at the time, was called the Corporation for National Service. Now it's the Corporation for National and Community Service. The Pew Charitable Trust was the other major funder. And the Health Resources and Services Administration, which is part of the U.S. Department of Health and Human Services, provided some technical assistance and support to the program. And it was administered out of the University of California, San Francisco, the Center for the Health Professions based there, and the National Fund for Medical Education, which was also based there. And I served as the project director for this program, so was involved from writing the grant to get the funding to do this initiative all the way through. The next slide shows you the diverse set of institutions that were funded under HPSISN. And I know that the disciplines and professions aren't listed explicitly here, but they represented schools and programs in medicine, nursing, public health, pharmacy, dentistry, and allied health. and in some cases there were multiple health professions involved. And you see it's a range of private and public institutions, large and small, urban and also more suburban and rural communities as well. And that was an explicit design of the program, was to support service learning in diverse settings and disciplines. The next slide gives you a sense of just some examples of community partners that these institutions developed and developed partnerships and service learning projects around over the course of their participation in HPSISN. There were organizations that were very health-focused, very clinically focused, like health clinics, but also partnerships with organizations that provide various programs and services in the community, but not necessarily in the classic sense of thinking about health and medical care, such as schools and churches, senior centers, youth centers, that sort of thing. In the next slide, just to give you a sense of this group of institutions and the service learning they were involved in, these are some examples of the areas of focus of the service learning work that students were involved in the community. School-based health, a whole variety of health promotion and disease prevention kinds of activities, case management, mentoring and tutoring in schools, for example. So they were involved in a variety of community projects and programs. The next slide just shows CCPH and our mission statement. This is Community Campus Partnerships for Health, because one of the outcomes of the HPSISN program was the formation of CCPH, which is a national membership organization that promotes community academic partnerships as a strategy of improving health. Service learning is a core part of what we're about, and the grantees were a core part of the membership that got the organization started. And then in the next slide, so why are we doing a follow-up study of this program 10 years later? Well, the real reason actually isn't even on the slide, and that's that Amanda Vogel, at the time a doctoral student at Johns Hopkins University, approached me and a colleague of mine at the American Public Health Association conference back in 2005. She came up to us. We were presenting a poster on a related project. It wasn't really about HPSISN. But she wanted to talk about ideas for her doctoral dissertation, to talk about some topics she was thinking about. And basically out of that conversation grew this idea of what about doing a follow-up study of this cohort of schools. It was coming up on the 10-year anniversary of the initiative of HPSISN. We were very interested in looking at what happened in the long run with these schools. We were aware anecdotally of a number of projects that had been sustained and partnerships that had continued because the grantees were involved in CCPH as members, but it certainly wasn't a systematic analysis of that. And so over the course of months of discussions and back and forth proposals, Amanda proposed this for her doctoral dissertation, and it was approved for her to pursue it. And so this group of schools presents a very interesting opportunity for this kind of follow-up study because they are a group of early adopters. This is pretty early on in the history of federal investment for service learning in higher education. It's still one of the few, if or only, demonstration programs in the health professions and one of a few in a single discipline or set of disciplines. And also, because there's some standardized factors across these grantees, the fact that they all received similar amounts of grant funding, they all had similar match, they all had similar technical assistance opportunities and so forth, it's really letting us look at some site-specific influences on sustainability, such as the environment, the institutional environment, infrastructure, resources, and the actual design of the service learning courses and programs within these sites. So overall, it seemed like an incredible fit in terms of Amanda's interest for her doctoral dissertation and our interest in really looking 10 years out to see what happened to these institutions. And really for the field as a whole, I think it's very unusual to be able to do this sort of follow-up study. It's not often possible to have the funds to be able to look long-term out over a period of years. And we had CCPH continued to be supported by the Corporation for National Community Service for service learning initiatives, and through that funding was able to in part support Amanda to do this work. So let me turn it back over to Amanda, and she's really going to take us through what she did and what she found.
Thank you so much, Serena. So as Serena said, I conducted the HPSISN follow-up study for my doctoral dissertation work at the Johns Hopkins School of Public Health, and now I'm a senior consultant with CCPH, and I'm a contractor at the National Institutes of Health at the National Cancer Institute. Today I'm going to be sharing the design that we used for the HPSISN follow-up study, our findings about what factors supported the long-term sustainability of service learning in this cohort of schools, and then our recommendations for how both academic institutions and funders can support the long-term sustainability of service learning. So there are important reasons to care about whether service learning is sustained and what factors can support sustainability. First, there are increasing investments in service learning by funders, by schools, also by community partners, and all of them want to ensure their investments aren't lost and that they can maximize the returns on their investments. Second, lapses in service learning can have detrimental effects. For example, reduced willingness among community agencies to engage in future academic partnerships. And third, service learning has a number of ambitious goals that can't be achieved in the short term, but a sustained commitment to service learning can help to achieve those goals. For example, enhancing mutual understanding among communities and schools, and shifting the culture and activities of academia toward greater community engagement, for example, in teaching and scholarship. And also building capacity in both academic and community partners to address community needs and work for social justice. And for all of those reasons, we wanted to learn more about what can be done to maximize the long-term sustainability of service learning. In the study, we asked 4 research questions, and the first 2 were about the sustainability of service learning. They're the first 2 on this slide. To what extent did the schools that participated in HPSISN sustain service learning 10 years after grant funding ended? And what factors influence the sustainability of service learning? So facilitating factors, challenges, and strategies for success, including strategies to address those challenges. In today's talk, I'm going to share our findings from those 2 questions, but I also wanted you to see the other 2 questions we asked. What was the long-term impact of HPSISN-supported service learning for academic and community partners, and what strategies did high sustainability schools use to maximize the quality of service learning? And if you're interested in findings from those 2 questions, on the last slide, or the second to last slide, there's a link to the CCPH website where you can download the full text of my dissertation, which has those findings in it. This slide summarizes the methods that we used for the study. The research was basically conducted in 2 phases. In the first phase, the aim was to do a broad survey of the participating schools to answer the first question about to what extent they had sustained service learning. 16 of the 17 HPSISN schools agreed to participate, and we interviewed the HPSISN principal investigators from each of those 16 schools. And then in cases where they weren't able to reflect on the entire tenure period, for example, if they had left the school or if they were no longer closely involved with service learning, we asked them to refer additional individuals we could interview. And the result was 23 interviews in total. We also engaged in document review to learn more about service learning at the schools. And the findings of the interviews were then analyzed with thematic coding and memo writing. In phase 2, we conducted in-depth case studies with 2 of the participating schools. So a main focus of this phase was to learn more about the strategies for success that they had used to sustain service learning. And that supplemented what we had already learned in the first phase of interviews about strategies for success and influences on sustainability. So for this phase, we selected 2 schools that we had identified in the first phase as having very high sustainability, and we selected schools that had very different institutional settings so we could learn strategies that would be appropriate for different settings. Each school also guaranteed participation in interviews by a broad group of stakeholders, including 3 community partner agencies. So we conducted in-person site visits to each school and 2 of the 3 community agencies. We conducted some document review about service learning at the schools and the agencies, and a total of 47 interviews. So those were about evenly divided between the 2 schools that participated and their community partners, and about 2/3 of the interviews were with academic partners like faculty members, service learning staff, and administrators, as well as students, and about 1/3 were with community partners. So that was directors of the community agencies and the main contact person there for service learning. These were our analytic approaches in these bottom bullets. And if you're interested in learning more about those analytic approaches, we can talk about that in the Q&A. And this study was approved by the Institutional Review Board at the Johns Hopkins School of Public Health. This table summarizes what we found in response to the question, to what extent has HPSISN schools sustained service learning 10 years after grant funding ended? So what we found is that of the 16 schools that participated in the study, 15 of the 16 had sustained service learning to some degree, which was unexpectedly positive. We were impressed. And we then put these schools into 3 categories that reflected 3 levels of sustainability that we created: low, moderate, and high. And on the left, you can see the number of schools that fell into each of those categories, with increasing numbers as sustainability went up. So the 3 levels of sustainability were distinguished by a couple of factors. One was whether service learning was integrated into the curriculum. Another was the extent of institutional resources that were provided to support service learning. Another was where those resources were located. So did they come from the level of the course, the department, the school, or the university? And the last was the presence of an institutional culture, policies, and infrastructure to support service learning. So to tell you a little bit about each of those groups of schools, schools in that low sustainability category lacked all of those sources of support for sustainability. So service learning wasn't integrated into the curriculum, and it didn't benefit from any investment of institutional resources, policies, or infrastructure. So basically, it was just being maintained voluntarily by individual faculty members. And in general, it was integrated into an elective course or a co-curricular experience. In the moderate category, all of these schools had invested significant resources in service learning. So first, they'd integrated service learning into required courses. And then they had invested resources at the level of the department. So that involved departmental planning activities, faculty time for service learning, hiring a service learning coordinator, and developing partnerships for service learning. At a number of the schools, there was also support for service learning in the culture of the school, as reflected, for example, in the mission, and also in supportive rhetoric for service learning among administrators, who then set expectations for engagement in service learning. And finally, in that last category, the high sustainability category, they had all the same sources of support for sustainability as the schools in the moderate category. And then they had additional support in the form of institutional policies and institutional infrastructure. So 3 of these schools had hiring, promotion, and tenure policies that supported faculty participation in service learning. And all of the schools had a service learning center, 5 of which also had a university level service learning center in addition to the school level center. And 4 of them had a steering committee that supported service learning in the health professions. So now I'd like to share what we found when we explored what factors influence the long-term sustainability of service learning. And I'm going to start with the facilitating factors. Participants described 3 sets of facilitating factors that supported the continuation of service learning, and these were factors in the institutional environment, the presence of infrastructure and resources to support participation in service learning, and characteristics of the design and implementation of service learning. So within that first group, participants described 3 key facilitators for sustainability. First, they described the importance of an institutional culture that supports service learning. And they described 2 ways that culture could support service learning. The first was that the mission of the institution reflected a dedication to service to society. But what was interesting is that it was participants from both faith-based schools and then state schools who described this factor. Second, the institution could have strong ties to the local community, and that then created a culture that supported service learning because service learning was seen as a way to support those ties. And it was interesting to find that participants from urban schools identified that culture. A second factor in the institutional environment that supported sustainability was support for service learning among high-level administrators at the university level and also in the health professions schooler program that participated in HPSISN. So this included, for example, the university president as well as university and school-level deans. So they described how supportive rhetoric from these administrators and concrete expectations for community engagement supported sustainability. They described also how deans were able to cultivate support for service learning among other decision makers, which created a more general environment in support of service learning. The third factor in the institutional environment described by participants as important for sustainability was having a critical mass of support for service learning. So they described how leadership from the top wasn't enough to sustain service learning, that sustainability also required the support of faculty members and students. And what they described is how each of those groups had a unique role to play in supporting sustainability. So they described how administrators created a supportive environment for service learning. They described how faculty members' buy-in was critical because they were the ones to actually use service learning in their courses, so they were the key to continuing to deliver a high-quality service learning experience. And they described how faculty could also build support for service learning among their peers and students. And finally, students were seen as important to sustainability because they could articulate the value to their educational experience perhaps better than anyone else. And they were also in the best position to demonstrate demand for continuing service learning. Participants also described how students at their institutions had created new opportunities for service learning, for example, through new community partnerships. The second group of facilitating factors was infrastructure and resources to support participation in service learning. And this is to support participation by everyone involved, faculty members, community partners, and students. Participants described two key factors in this area. The first was having a service learning center that included resources to sustain service learning. So these included a full-time service learning director with the skills and time to support participation by faculty members, community agencies, and students. So for example, maintaining community partnerships and helping students identify service learning opportunities that suited their individual interests. The second was resources to support service learning, for example, pre-existing community partnerships, teaching tools, for example, tools to structure preparation and reflection activities, and quality standards to guide faculty and community participation in service learning. And the third resource within that center was actually its location. So they described how a centralized location for the service learning center and the organizational structure, for example, at the level of the office of the dean of the college rather than in a department, enabled the center to support and engage the entire school in service learning and to participate in strategic planning for service learning at that level. And that also helped to sustain service learning. The second key resource was support for faculty participation in service learning. So this was specifically support for faculty. And as I mentioned before, faculty participation was understood to be the bottom line for sustainability. Participants identified a number of important sources of support for faculty participation, and these included initial training, ongoing professional development opportunities, and technical assistance when planning for service learning and then when engaging in service learning, as well as resources to help implement service learning in their courses, like the ones I just described as being provided through the Service Learning Center, and incentives and recognition to support their involvement in service learning, for example, fellowships or stipends to support them when developing a new service learning partnership or a new component in a course for service learning, as well as course release time to compensate them for the additional time needed to engage in service learning. The last of the three groups of facilitating factors was aspects of how service learning was designed and implemented. And interview participants identified three key facilitators in this group. So the first was integrating service learning into required courses, which involved using service learning to teach valued learning objectives in those courses. Participants from some sites really drove home the importance of integration into the required courses. They described how even when funding no longer existed to support service learning at their institutions, and even when they had no service learning director or service learning center, because they had integrated service learning into required courses and tied it to teaching valued learning objectives, service learning was sustained and sustained at a very high quality level. The second facilitating factor in this group was having a full-time service learning director, something I mentioned before. But the difference here was skills not only to implement service learning, but additional skills including the ability to advocate for service learning at the institutional level, for example, advocating for more funding for service learning or for the institutional value of service learning, and a person with the ability to cultivate champions for service learning to build that critical mass of support. And finally, the ability to provide leadership for using service learning in creative ways to address key educational goals and community goals. So a participant described this as, quote, staying current, both in the university and in the community, in order to maintain the value of service learning and therefore sustain it. The third facilitating factor in this group was investing in stable, long-term community partnerships for service learning. Participants described how sustainability on the academic side wasn't sufficient and that continuity and commitment in the community was equally important. They described how this could be achieved by implementing key principles of community campus partnerships. For example, using service learning relationships to help partners fulfill their organizational missions and providing technical assistance and professional development to community partners. And they said there was a need to select partners who could also make a long-term commitment to service learning. For example, selecting stable organizations and organizations where their leadership had bought into service learning. So now I want to move on to the challenges that were identified by our participants. What's interesting to note is that participants from institutions at all three levels of sustainability identified challenges, and these were the 5 main challenges they identified. The first was turnover among faculty participants in service learning. Interview participants at schools where service learning wasn't integrated into the curriculum described how faculty turnover could lead service learning to be cut from the curriculum or dramatically reduced. And participants at schools where service learning was integrated into the curriculum also identified turnover as a threat because it could reduce the quality of service learning, and that in turn was a threat to sustainability. The second challenge was competing priorities for faculty time, and actually this was particularly true in research-oriented schools where promotion and tenure policies emphasized research and where faculty interview participants described how they had engaged in service learning, quote, in their spare time. And both of those factors threatened, therefore, to reduce faculty participation in service learning. The third challenge to sustainability that participants mentioned was turnover among champions for service learning at the level of high-level administrators and also among highly regarded faculty members. Participants from low and moderate sustainability schools described how turnover in leadership had led their institutions to deprioritize community engagement, and as a result, service learning had been deprioritized and time for service learning had been drastically reduced. Even participants from high sustainability schools spoke about how the departure of highly regarded faculty members who were champions for service learning had led to significant drop-offs in participation among both faculty and students, and they saw drop-offs in participation as a threat to sustainability. There were 2 additional challenges. reflected on this slide. So the fourth challenge to sustainability that participants described was competing educational priorities. And they described two ways that new educational priorities could compete with service learning for a place in the curriculum. The first was if service learning was not seen as an appropriate tool to teach those new educational objectives. So in our study, participants identified two competing priorities, which were clinical care skills, clinical care skills and research skills. But in other professions or disciplines, there might be other competing priorities that you could think of that might pose a threat to service learning and the place that's held in the curriculum for it. The second way that competing priorities were a challenge was when there were so many educational objectives that students were required to complete that their schedules were overloaded and time for service learning was therefore reduced. The fifth and final challenge participants described was how to grow their service learning activities to accommodate increasing student participation and also increasing desire of their institutions to engage in service learning, but doing so in the context of having limited resources to support participation among faculty members, community members, and students. And they described how lack of resources to support the growth of service learning could decrease the quality of community partnerships as well as classroom-based service learning activities, and how those reductions in quality could in turn threaten the sustainability of service learning because they could decrease interest among participants in engaging in service learning in the future. Now I want to
Amanda,
yes.
Can I just interrupt to just do a quick shout out to remind people that they, even though we're not taking questions, as questions occur to them, they should remember that they can type them in the Q&A section at the bottom, and that way we'll get to more questions if folks type them up as they think of them. Thank you.
Thanks, Kevin. So the last set of findings I wanted to share was the strategies that participants shared. So participants from schools at all three levels of sustainability identified the challenges that I described. But what distinguished among schools at the various levels was whether they were able to respond effectively to those challenges and the extent to which those responses were effective in their settings. I wanted to describe the 5 strategies that participants offered for how they had addressed these challenges in their settings. So the first of these strategies was to provide ongoing opportunities for faculty professional development to address the challenge of turnover among faculty. So this included new faculty orientation, for example, using peer-to-peer outreach and mentoring to support new faculty engaged in service learning for the first time, as well as the support of the service learning staff for these faculty via professional development and technical assistance. The second strategy used to address these challenges was to articulate how service learning contributes to valued educational objectives, including both currently established objectives as well as new and emerging objectives. So participants, for example, described how they had used service learning to teach to current educational objectives that were central to the core curriculum. And participants from some schools identified how they were able to link service learning to achievement of accreditation requirements. These were all participants from nursing and pharmacy schools who described the ability to do that. In nursing schools, it was past optional accreditation guidelines, and in pharmacy schools, it was current guidelines. Participants also described how they used service learning to teach emerging hot topics. So in the health professions, in our cohort, they described the following topics they were using service learning to teach to: electronic medical records, health disparities, and cross-cultural communication. But I think that finding is likely generalizable to other professional schools and perhaps more widely. And finally, participants described how they use service learning to establish new educational priorities. So I wanted to give you an example of this. One of the schools in this study created an interdisciplinary service learning initiative, which involved students from nursing, medicine, physical therapy, and other health professions in a single interdisciplinary service learning team, which provided service to a community partner organization. And what they found is that students were learning skills for interdisciplinary collaboration. I should state they did an extensive evaluation of student outcomes. And what they found is that these skills for interdisciplinary collaboration were immediately relevant to the clinical care they would provide on graduation, such as respect for and understanding of different professions' skills areas. That's a national priority area that's growing in terms of health professions education and training that they identified as being uniquely addressed by service learning and nowhere else in the school. And by identifying that priority, they in effect created a new priority area for the school. The third strategy that participants described for addressing these challenges was to articulate how service learning contributes to broader educational goals, broader institutional goals outside of educational goals. And they described three broad institutional goals that service learning contributed to. The first was improvements in town-gown relations. Service learning was used at some of these institutions as one of multiple factors that were being used sort of in a package of activities to improve town-gown relations. And some of the interview participants who cited this outcome of service learning also described the secondary benefit of improvements in public relations and even in fundraising as a result. A second broad institutional goal that was identified as a link to service learning was other valued initiatives. So participants described their work to identify how service learning contributed to other valued initiatives such as research centers, elective tracks that were draws for students, and other required community-based training activities, for example, practica, internships, and fellowships. And they had articulated how service learning could support the activities of these practica, internships, and fellowships by sustaining community partnerships through a reciprocal relationship. And finally, participants described how service learning had been articulated as a tool for student recruitment and how some of them were working closely with their student recruitment offices and marketing offices to use service learning in this way. The fourth strategy participants described to address challenges was engaging in internal marketing of service learning. So it wasn't enough for them to know, for the service learning champions to know how service learning contributed to educational objectives and institutional goals. There was the need to publicize these messages. So they spoke about engaging in internal marketing through university newsletters and newspapers, and also through the local media, for example, local newspapers that could reflect the benefits of service learning to the local community and also, in fact, market service learning locally. They also described how they focused individual attention on developing champions in the administration. So by bringing this information about the value of service learning, particularly to administrators who had an existing interest in the community or in community academic relations, and using that sort of pre-existing interest to cultivate champions. Among research institutions in this cohort of schools, another way that they identified as critical to engaging in successful internal marketing was to engage in extensive evaluation of service learning. So a number of participants described how at their schools the outcomes of service learning had been evaluated for students, faculty, and community and partners. And by having these hard data, they were able to then successfully make the case in an institution where the culture valued hard data like that. The fifth and final strategy that participants used, and this was to address the challenge of growing a service learning initiative while retaining its quality, was to engage faculty members to support the activities of the Service Learning Center. So that involved engaging faculty members in peer mentoring to support faculty participation in service learning, and engaging them also in maintaining community academic partnerships to support the activities of the Service Learning Center in maintaining those partnerships. I'd now like to discuss the implications of these findings for both academic institutions and funders with some recommendations. So these findings suggest a number of recommendations for how academic institutions, including administrators, faculty, and service learning staff, can support the sustainability of service learning. Ideally, the first recommendation is to have sustainability as a goal from the start of service learning activities. Obviously, many of you on this call have been actively engaged in service learning for years, but to make service learning an articulated priority, to make sustainability an articulated priority from the start or from whatever stage you're in now is the first step in planning for successful sustainability. The second recommendation is to appoint a service learning director who has both the time and the skills to implement the strategies for success that were identified here by our participants. So this can't be done in the spare time of others, and having an individual who's a champion for service learning who can engage in these advocacy skills and support strategic planning for service learning was identified as critical by our participants. The third recommendation is to actively plan for sustainability by developing incremental goals to work towards sustainability and then revisiting them periodically to assess your progress as an institution, challenges that have emerged, and strategies that you might use to address those challenges. So, for example, how will you link service learning to the institutional culture, and how will you make a convincing case for how service learning supports cultural values at the institution? What will you do to develop a critical mass of support for service learning at your institution? How will you integrate service learning into the curriculum? How will you use service learning to teach to valued educational objectives? And continuing on this next slide, how will you secure resources to support faculty participation in service learning? And what will you do to build strong community partnerships for service learning? A final recommendation is to identify current and anticipated challenges and then plan strategies to address or prevent them. So, for example, how will you address turnover among champions if you believe that that may be a current or anticipated challenge? How will you address turnover among faculty members who use service learning? What competing educational priorities exist now, and are there others that you can see on the horizon? And how will you articulate the equal value of the educational objectives that are taught through service learning? How will you revisit service learning over time to ensure that it remains relevant to changing educational objectives? And what process will you engage in to adapt service learning to new objectives? And finally, how will you plan for growth while also maintaining quality? So what existing resources may you be able to tap? And what new resources will be needed, and what process will you engage in to plan for how to obtain those resources? The next couple of slides are recommendations to service learning funders. So these recommendations are related to the institutional environment on this page. And the recommendations relate to both requirements for grant applicants, and some later recommendations will be related to requirements for grantees. So related to the institutional environment, my recommendations are to require grant applicants to include a compelling argument about how service learning appeals to the institutional culture, and if needed, describe how they'll make this case at their institutions. My second recommendation is to document existing support for service learning among administrators, for example, a letter of support from high-level administrators, as well as faculty and students. Or, if that support does not exist, to have them describe a plan of action for how they will plan to cultivate that support. Related to infrastructure and resources to support participation in service learning, my recommendations are to require grant applicants to describe what infrastructure and resources currently exist that could be used to support service learning. For example, a community engagement center that could then be utilized to support service learning, or, for example, a center on research and health disparities that could be used to support service learning, as well as faculty participation. to support service learning activities at the Service Learning Center. And then they should describe how they plan to leverage those resources. Or, in the absence of those resources, they just should describe what process they'll engage in to develop that infrastructure. And another recommendation here is to provide matching funds that, to have grantees provide matching funds that increase over the grant period in order to prepare the school to then fully support service learning by the time the grant funding ends. So this is a way then to create internal funding for the infrastructure and resources needed to support service learning. Related to how service learning is designed and implemented, funders could require grantees to integrate service learning into the core curriculum and use service learning to teach to core educational objectives. Identify a current full-time service learning director already at the institution, or describe their plans to hire a service learning director with skills to work with administrators, community partners, faculty, and students. Grantees might be required to describe how they'll nurture stable, long-term community academic partnerships, and they might be required to earmark a portion of funding to support professional development and capacity building in community partners. And finally, funders should provide support to grantees to address challenges which are going to be inevitable over the long run when you're looking at long-term sustainability with professional development opportunities. And in a resource on the CCPH website described on a later slide, we have a list of suggested topics. So I wanted to close, like any good researcher, with some limitations. So the findings from this study should be interpreted in light of these limitations. The first is limitations to the generalizability. So this was a study with 16 health profession schools. And as a result, the findings may not be generalizable to other schools outside of these 16, and especially outside of health profession schools. However, the fact that these findings reflect many of the themes in the existing literature creates evidence that suggests that they are, in fact, more generalizable. And we also believe that these findings may be generalizable to other professional schools that face some of the same challenges. For example, rapidly evolving expectations for the educational objectives and competencies that students are expected to master. The second limitation is that there are restrictions in the variables that could be explored in this study as influences on sustainability. So this cohort, as Serena described, had grant funding, matching internal support in cash or in kind, technical assistance and professional development during their startup phase of 4 years. And therefore, we couldn't explore the influence of those factors on long-term sustainability. And in fact, some of them may be an influence. Rather, what this study did have was a focus on site-specific influences, so factors that differed among the schools, as well as influences that occurred in the 10 years after funding ended. And finally, the last limitation to keep in mind is recall bias. So this was a retrospective study. We asked people about their experiences with service learning, their institution's experiences with service learning over a 10-year period of time. And in any retrospective study, there's going to be some bias. For example, in the schools that successfully sustained service learning, they might identify more facilitating factors, and in those that had been less successful, they might identify more challenges looking back. That closes this portion of the call, and Kevin is going to now moderate the discussion, and I think make a few comments as well.
Thank you, Amanda. Once again, I want to thank Amanda for bringing forth her research. I think it's clear that it raises some interesting questions for both institutions of higher education and for those who are funding service learning to untie this knot about sustainability. And her recommendations, particularly for funders, are ones that we at Women's of America have looked at closely. And are always thinking about ways we can implement to assure long-term sustainability. I do not want to take up much of your time because I think the questions that we have queued up are going to get us into what I hope is an interesting discussion. I will say just very briefly that we at the corporation are very interested in the long-term effects of our funding. As I've said in the past, we have thought of our funding as seeding service learning in the field with the idea that service would to keep the garden that we're moving forward that would take root and grow. And so the research that Amanda and that Serena has supported is critical to getting us some insight about whether those things are happening and what we could do to encourage and support and develop a long-term commitment to service. And the research indicates that there are some factors that are encouraging that development, ones that we ought to continue to examine and push forward. And there are some things that require us to rethink how we do business and maybe raise the stakes. It's always been Learn and Serve's objective to really critically change the way in which higher education operate. So we see this mission as long-term, and we see research like Amanda's helping us understand how we're moving through this journey and how we are, in ways which we are being successful and in ways that we are not being successful and we should change up. Like I said, I have lots of questions queued up here. We, I think, have about another 25, 30 minutes left for questioning and answer period. So let me quickly get to the questions. I'm going to have a question here from Jim, who it looks like is at CUNY Graduate School. His question is, were the facilitators to sustainable service learning mentioned by Amanda already part of the institutions with which she was researched? Or did they, over time, after exposure to the benefits of service learning activities, come to those institutions?
That's a really great question. And actually, I was able to see that question before and think about it. I think what's helpful about these three categories of facilitating factors is that it sort of distinguishes between the factors that are malleable and not malleable. So the first group of facilitating factors was factors in the institutional environment. So, for example, the culture of the institution is something that was present at these institutions, at many of them, at the start of the HPSISN initiative. Not at all of them. At some of the institutions, they did describe how the culture had shifted over time. And they described HPSISN as one of many factors that had contributed to that shift over time. They also discussed sort of just a shift in general in the health professions about greater interest in community engagement and in higher education more broadly as shifting the culture. So culture, though, at many institutions is a less malleable factor and one that advocates and champions for sustainability and service learning can't influence or have less power to influence. Some of these other facilitating factors were ones that were either established under the requirements of the HPSISN grant, for example, integration of service learning into the curriculum, and HPSISN did fund a position, a service learning coordinator position, and then others are in fact, and I would say, looking at the facilitating factors, these 8 of them, I'd say more than half probably did evolve over time. Due to the efforts of the service learning advocates at these institutions. So, for example, while HPSISN provided support for a service learning coordinator. At many of these institutions, advocates for service learning, including the principal investigators, as well as others, advocated for the creation of a full-time service learning director position. And in time, at a number of those institutions, that director position evolved into a center or office. Support for faculty participation in service learning. Again, this was a factor that existed under the HPSISN grant, but then a number of participants described how in recent years, with greater turnover in faculty who had participated in that grant, their institutions had committed to significant efforts to train new faculty in service learning. So again, that was a facilitating factor that occurred later. And your question is, did some of these factors develop after exposure to the benefits of service learning? And I would say the answer is yes, both exposure to the benefits and the presence of champions who were able to clearly articulate those benefits and articulate the value of service learning, and therefore the need and the value of providing additional infrastructure and resources to support it.
Great. We have another question, which is really a kind of a logistical one, which is from Ashley Frazier, who's asking whether or not these slides for the presentation will be made available after the presentation.
So I think the answer to that is that they will be available. Is Liberty on the call? Will they be available on the servicelearning.org website?
Hello, this is Larry, the webmaster for the National Service Learning Clearinghouse. And yes, both the recording and the presentation will be available on the website for download and for view.
And this is Serena. The slides will be up on the CCPH site also.
Great. Another question from Jim from CUNY. Did you find that the strength of the community organization in terms of resources, internal structure, sustainability of their organization played an important role in sustainability of service learning programs in the academic institutions?
So also a very interesting additional question, and one that I was looking out for in the analysis of these findings. And in fact, I found something a little bit different. So what I found is that what was important was the stability of the commitment to service learning and the stability of the commitment of the leadership of those organizations to service learning. So many of these interview participants described how there was, in fact, significant turnover among the staff members at community organizations that were partners for service learning, the staff members who were sort of the main contacts. But how what they described is that continued dedication to service learning amongst the leadership of the organizations had helped to sustain their participation. They also identified other factors in the relationship, the community-academic relationship, that were important to sustainability. So one was having a memorandum of agreement, which is very common. Another was creating reciprocal benefits for community partners. Another was, so I described some of those reciprocal benefits. For example, engaging community partners in professional development and capacity building, and making sure that service learning activities and the partnerships more broadly helped contribute to their organizational, their agency goals. Let's see. I had one more that's now slipped my mind, but maybe it'll come back to me. But what was most important was the leadership and the relationship, and not the stability of the organizational structure. Great.
Looks like we have a question from Desiree Simmons from Simmons College. Can you tell me more about how service learning was used for the recruitment of students?
Sure. So participants from a number of the schools described how service learning was identified as a draw for students, both because this millennium generation of students is more actively engaged in service and more concerned with integrating service into their educations, and also because of an influence on community engagement or community practicum experiences in the health professions. So they identified how students were interested in service and community-based practical experiences, and service learning had been identified as a way to attract these students. They also described how service learning set their institutions apart from other institutions in their local areas. So, for example, if there were 3 nursing schools in an urban area, the fact that they had service learning could be used as a way to distinguish their institution from others.
Great. Thank you, Amanda. We have another question from Deborah Bailey, who's asked, did you look at the positioning of service learning offices in your study, whether they were on the academic side, student affairs side, and where those offices were located in the institutional hierarchy?
So I didn't answer this whole question, so I answered part of it. So I looked at whether the center and the service learning director was located in the department, school, or university. In the literature on sustaining service learning, the centralized location of the service learning center in the hierarchy of the institution has been identified as an important influencing factor, and that's what I ended up looking at. And in fact, what I found is that the level of the service learning center tracked with other variables that were in that table, sort of identifying the 3 levels of sustainability. I didn't look at differences in the academic side versus student affairs side centers, and that's a really good question. At many of these schools, in fact, the centers did fall on the student affairs side, even though I do know that there is now discussion about the relative value of academic versus student affairs located centers.
Great, thank you. We have another question from Desiree Simmons, who has asked, when speaking about professional support for community partners, who would provide the training?
So I'm assuming, Desiree, you mean when I said professional development for community partners? And if that's not right, send us another note. So that's a good question. In my mind, and in my sample, there were institutions where the service learning director had the skills to work with both faculty members and community partners. So let me give you some examples of how that professional development for community partners was provided. One was including or funding community partners to attend conferences on service learning so that they could get all the benefits of that educational experience that their academic partners could obtain. Another form of professional development and technical assistance for community partners was that was used by participants in this cohort was to gather community partners a few times a year with or without their faculty partners to discuss how their experiences were going and to learn from some of the partners that had long-standing successful partnerships about how they could enhance what was going on in their partnership. So those activities were organized by the service learning director, but called on the experiential knowledge of some of the longer-standing community partners. I could also see, as a spin-off idea on that, inviting in successful community academic partnerships to discuss what they've done to enhance the quality of the experience for the community partners and the students.
Thank you. We have a question.
Oh, Kevin, just 1 second. This is Liberty
Sure.
Smith again. I wanted to suggest that when we get through this next question, we still will have about 10 minutes to go, I think by my clock, although I may be a little off. So if folks are willing to, please chime in using the phone line by unmuting with *7 and remuting with *6. Just so we get some other voices on the line. Not that these aren't lovely voices.
No, thank you, Liberty. That's great. So so if you are like me, think faster than you can type, and you want to ask a question as soon as we get finished with the ones that we've queued up, please remember to hit *7 to unmute your phone, and then you can ask us the question. And then if you would, remute by hitting *6 again so that we can answer your question without hearing the background noise. Okay, we have a few more questions, and so I want to get to Mary Alice's question, which was, what are some good strategies that can be used to assess whether community partnerships will be stable ones?
Good strategies to assess whether community partnerships will be stable ones?
That's correct.
Yeah, well, there were a couple of factors identified in this cohort, which I described, and I'm happy to mention again. So one is a commitment from the director of the community agency to service learning, buy-in amongst the directors of service learning. And another is sort of a stated commitment to a long-term relationship, and that could be reflected in a memorandum of understanding, for example. So that desire to commit for the long term among community partners should match the desire of the academic institutions to commit for a long-term relationship, as opposed to, for example, a one-off service learning opportunity like a one-day health fair. Obviously, you want to give community partners the opportunity to engage in a partnership and try it out. But a commitment, a stated commitment to further engagement when a partnership is going well is what's needed. Yeah, according to these participants.
Okay. Ashley Frazier asked, I think she's quoting you here, you talked about the ability to teach current core curriculum and accredited requirements. You mentioned EHR as an example. Can you please repeat the other examples you gave, Amanda?
Sure. So in this cohort of participants, participants from pharmacy and nursing schools described how service learning had been used at their institutions as a way to fulfill accreditation guidelines. So at nursing schools that participated, a couple of them described how during the HPSISN grant there was an optional guideline for service that they were able to link service learning to. And then once service learning had been incorporated into their curriculum, that guideline, that optional guideline, no longer existed, but they were able to continue the service learning. Among pharmacy school participants, they described how recent guidelines for clinical practice training had been the hook that they had used to integrate service learning into the curriculum. So these were early clinical practice opportunities that were being fulfilled through service learning.
Great. We have two more written questions, and then we'll open the lines up for questions. One question here was, could you tell us which school implemented interdisciplinary service learning team?
No, I cannot tell you because all of the participants were consented with the understanding that the findings would be anonymized.
Okay. Final question before we open up the lines for additional questions. Can you speak to the challenges of the institutions involved in the study in building the infrastructure, that is, community engagement centers, service learning coordinators' roles, to support an institutional mandate of community-based learning?
So,
mouthful.
Yeah. I think that that probably what these I think from this study, the general experience was that service learning was led from the middle up, not from the top down. So I don't know if I can really directly address this question, but I think that that's an important point to reflect on, that it was faculty members and service learning staff members who were the driving force behind service learning and developing the infrastructure, and that they pushed their institutions to identify resources to support service learning. So I'll give you an example that drives that home. One of these participants who was a dean, and there were a number of participants who were deans. They didn't all start in that role, but then 10 years later, a number of them were. He described how the faculty members who were champions for service learning were really the keys to the growth of service learning at the school, and not necessarily the leadership. I can say that in this, there is some probably response bias here, because in this work, I interviewed individuals from across 16 schools, so sort of the breadth of their experiences is what I'm referring to, and most of them were faculty members and service learning directors rather than deans. So if I had interviewed 16 deans and university presidents, I might have gotten a different perspective on where the leadership was coming from. But while individuals identified the extreme importance of leadership from the top, it was clear that leadership was coming from all interested stakeholders in service learning.
Great. Okay. Now it's time for us to throw the lines open and see if we can take some questions.
Just one reminder, this webinar is being recorded, so if you're uncomfortable being recorded, please don't ask a verbal question. Thank you.
Thanks, Liberty. If you're interested in asking Amanda a question, remember, hit *7 to open your line, ask your question, and then hit *6 to mute it again. Do we have any questions?
Kevin, this is Serena. I just wanted to jump in. I know it's frustrating to hear the answer to the question about whether the identity of these schools can be released, and they really can't be because of the way the study was designed. But I did want to mention that on the CCPH website we have a very extensive section on syllabi, case studies, course materials, models of service learning and interdisciplinary collaboration in the health profession. So the person that asked that question, there actually were 7 of the original HPSISN grantees that wrote case studies on their interdisciplinary programs, and they're all posted as PDFs on the site. So there are a lot of resources out there that hopefully can be helpful to people, but we can't specifically name names in terms of this study.
Thank you, Serena. Yes, there are tremendous resources out there, and we hope as a result of this webinar that folks will take advantage of those resources and are able to find the answers to the questions that they're seeking. Again, if you're interested in asking a question to Amanda or Serena or to myself, remember, just hit *7, ask your question, and then hit *6 to mute your phone again.
Hello, this is Desiree Simmons again. I have a question about when, Amanda, you were talking about engaging in internal marketing of service learning, and you talked a little bit about the evaluation and how that was used in looking at outcomes and hard data. And I just wanted to know what sorts of outcomes folks were looking at or what they were studying. Exactly.
Yeah, sure. Well, participants described looking at learning outcomes. So identifying the core learning objectives that service learning was being used to teach to, and then identifying learning outcomes in those areas. And those core learning objectives were around civic professionalism, community-oriented primary care, and understanding of the roles of community agencies in supporting public health. More technical skills included patient-provider communication, cross-cultural communication, a better understanding of health disparities and social determinants of health, an understanding of the roles of health professionals in relation to each other, so interdisciplinary collaboration in the programs that had interdisciplinary service learning opportunities. Participants who engaged in evaluation also described how they had evaluated the outcomes for faculty members and for community members. So for faculty members, they looked at outcomes around developing partnerships that were then used for scholarly practice and for community-based research and translation of research findings into programs and practice in the community. In community partners, they looked at whether service learning was fulfilling needs of the clients of the agencies, whether it was addressing organizational objectives of the agencies. They also looked at attitudinal factors, so community partners' experiences participating in the education of health profession students and their evaluation of that experience.
Great. Thank you. Any other questions? Once again, if you want to ask a question, hit *7 to unmute your phone, ask your question, and then please hit *6 again to mute it back, and we'll give an answer. Okay.
I think there are a few more slides. I'm pretty sure.
Are there more slides you want to go through, Lynn?
There's this slide. I think it's helpful maybe to mention this. So this first point is the CCPH website, and there's a search window on the left-hand side of the site, and if you type in HPSISN follow-up study, you will be taken to the page with all of the information about the products of this study. So all of the prior slide sets, posters, articles, and the full text PDF of my dissertation where you can read the results from the other research questions. For those suggested professional development topics to be supported by funders, this is the slide set to look at, this April 2010 talk at CNS. Also, Serena and I and our colleague Cheryl Gilman co-authored an article reporting findings from the first phase of this research. And that's in this next bullet point. So it's published with Michigan Journal of Community Service Learning, and that's the website there. The hard copy will be published and out in late October, and I'm imagining that you'll find the abstract online around that time. This is the title and the partial citation. We don't have the page numbers yet.
And this is,
yeah, go ahead, please.
Oh, okay. And this is a Liberty, again, from the Clearinghouse. All of the materials from this webinar, as well as links to the resources that Amanda mentioned, will be available on our higher education sector page, which is the primary resource for any of our targeted materials for the higher education sector. So that's where we will have the webinar recording. Please share that with any of your colleagues. And shortly, within the next few days or within the next week, we'll have a fact sheet posted that includes some of the information from this webinar and from Amanda's research on maximizing community impact in higher education service learning. So please do go to that page for that information. We will also send a link to that to the participants and any other follow-up materials that Serena and Amanda want to share I'll probably contact Jessica Wade about some information we have on interdisciplinarity. Thanks, Amanda.
Great.
Thanks, Liberty. Finally, this is our contact information for myself and Serena and Kevin, and feel free to email us.
Great. Well, I want to thank Amanda for doing the work and for being willing to share it not once but many times. As I said, it's really important work that we're so happy she's undertaken, and we find the information provided in this research and the study to be both interesting and useful and will influence us as we move forward. I want to thank Serena for supporting Amanda's work and for being a wonderful partner. And I want to thank my colleagues at the Clearinghouse who are always, who are always a joy and a pleasure to work with. I hope you have found that this webinar to be as interesting as I have, and I think my job as a moderator is complete. Go forth and have a wonderful evening or afternoon, folks.
Thank you very much.
The chairperson has disconnected. The conference will now end.